Well, my son reckons I can work for 8 hours now without stopping. Whereas before I couldn't do 8 minutes. That's the noticeable difference. My name is Robert Upton. I'm 76 and I'm from Newcastle West, County Limerick. I realised it a few years ago that I would have trouble later on in life when there was slight calcification of the aortic valve. But that wasn't causing any trouble, and while it wasn't causing any trouble, I just lived with it. You know, I knew it was there and I kept an eye on it every few years, and that was about it. I was getting chest pains and shortness of breath. If any exercise at all, was a severe shortness of breath and chest pains, and that was really the main symptoms. When I got the chest pains, I actually done a little stress test on my own and found out I couldn't walk up more than about 10 steps without actually being wrecked. So went to the GP and we immediately diagnosed that it was a heart valve and possibly in need of a stent. I'd been doing some reading about the TAVI, and I was really in favour of it. The durability of it now is increasing all the time. It's not very invasive, and you feel great after it. Maybe a slight discomfort, a slight bit of bruising around the area where they've gained access to the artery in the groin area. But apart from that, no problem. As soon as I woke up, I could feel the difference. You know, the parts of me obviously had been starved of everything, but I could actually feel it. It was instantaneous. And discharged then on. I had it done on the Friday. Discharged Monday morning. Well, my son reckons I can work for 8 hours now without stopping. Whereas before I couldn't do 8 minutes. That's the noticeable difference. But to get my level of fitness up again is going to take some time. But I walk now around about 4 or 5 Ks most days without any problems, whereas before that wouldn't have happened. It just couldn't happen. Get yourself to the doctor. Get it checked out. Above all, don't delay. Really, I think that's a killer.